Welcome to the Team Teach podcast. I'm Claire, and in each episode you'll find me talking with an expert guest to learn more about behaviour. We squeeze a lot into each episode. You'll listen to the latest thinking in behaviour, continue your professional development with our book recommendation, and then I'll send you away with 3 practical tips you can use in your setting. I'm really excited today because we've got a returning guest. We've got Andrea Reid-Kelly, who is the Deputy Chair of the Noonan Syndrome Association UK, and she's talking today about Noonan Syndrome, education and behaviour. Hi Andrea, how are you?
I'm not too bad, Claire. Happy in the sun.
Always well.
Yeah.
Sunny all year round in the UK, let's pretend. But we're so pleased that you wanted to come back on and talk about a real interest and kind of passion of yours, Noonan Syndrome. But I wondered if you could start off and just tell the listener a little bit about yourself and your background.
Yeah, so I'm actually a teacher with a special needs teacher, really, primarily, with a experience in autism mostly. But I have Noonan syndrome myself, and was diagnosed when I was 16. So have an understanding of what it's like to live lived experience going through school, in life, having Noonan syndrome. And as Deputy Chair of the Noonan Syndrome Association, we really sort of keen to provide support to other families, and we have really good connections with our membership. And so we get a lot of information requests in that inform our advice to other people as a result. So, yeah.
Yeah, and we're so lucky in 2 ways to have you on, as someone with lived experience of the condition, and also someone has experience of you of working with different individuals, neurodiverse individuals, special needs. So yeah, we're definitely covering all bases, I think, with this topic. I know maybe like me, the listener will be wondering the same question. So when I saw the topic, I saw, oh, it's Andrea. I've met Andrea before. I was like, Noonan syndrome. I've actually not heard of that. And generally when I do the podcast, I don't have to do loads of research because I'm pretty clued up on quite a few things. So I wondered if you could tell the listener a little bit about Noonan syndrome, just to start us off.
Yeah, well, it's actually a rare disease. And that word disease can be a bit frightening. It's just a medical term that it's not anything infectious. It's just a medical term for a condition that affects your health, essentially. And to be classified as a rare disease, it should affect fewer than 1 in 2,000 people. Okay? So Noonan syndrome, we used to say it was fewer than 1 in 2,000 people, but now with genetic testing, we're realizing it's actually much more common than we ever thought, because people being tested that have very, very few obvious symptoms and wouldn't have got a clinical diagnosis. So now we're saying it's probably potentially fewer than 1 in 1,500 people.
Okay, yeah.
Okay. Now, if I just put that into context, I can compare that to 2 different conditions that most of us have heard of. So sickle cell disease and haemophilia, for instance. Now with sickle cell disease, that is affects roughly fewer than 1 in 2,000 people. Now that's incidence is much higher in specific ethnicities than it is in others. But overall, in the general population, it's 1 in 2,000 people. But haemophilia, which most of us have heard of, it's fewer than 1 in 10,000 people. So if you're thinking about both those conditions, Noonan syndrome is potentially more common. And this is why we're actually, one of the memes that we hear a lot internationally now when people talk about Noonan syndrome, is the phrase is, it's the rarest, the most common rare disease you've never heard of.
Yeah.
Okay. So, and which is kind of fun, but also potentially not true. I don't know, because just as Noonan syndrome is being tested and more people have been found through genetic testing, I'm sure that's happening for so many of the rare diseases. Yeah. So what used to be the numbers for rare disease is probably getting much lower, if you know what I mean. To be classified as a rare disease, it's probably coming down in its frequency. So So Noonan syndrome, what is it?
Yeah.
So again, if we compare it to sickle cell and haemophilia, both those conditions have a result from a gene change that affects just one thing in their body, the production of the blood cells and how they're formed. So sickle cell, the shape of the red blood cell is changed, so it's not as effective. Okay, and that affects, so it's about the cell production. Whereas haemophilia, it's a change that has affected clotting. Now, both of those conditions have very serious implications for a cascade of health conditions after it. So you get lots and lots of different conditions as a result of sickle cell and as a result of haemophilia. Noonan syndrome differs from those two conditions in that the cell change has happened in the RAS-MAP pathway. And that means RAS-MAP pathway controls the regulation of cells, the growth of cells, the division of cells, the survival of those cells, the differentiation of those cells. So what the cells begin to do and whether they're turned on or off. Okay. Now, because of that, because it's a gene change on that pathway, there is the cell in every cell in our body is potentially affected by Noonan syndrome. Now, that's different amongst different people, like might not be very severely affected, or not every cell is affected, but most of them, or some of them. But for the majority of us, almost every cell is affected. And that has implications for everything about us. So although I say, like, I have Noonan syndrome and I'm not defined by Noonan syndrome, I'm also really, really aware of it having this huge impact on who I am, my character, my social being and my well-being, my physical health. It has an impact on every single thing, potentially, even though there's so much more to me than Noonan syndrome. Yeah. That makes sense.
It really does. That's such a clear kind of definition, and that idea, Andrea, as well, of having something that that doesn't define you, and you are separate from the disease, the condition. Yeah. But actually, it does define some of your behaviour, your mental health, your well-being, and I just think that that's a really clear definition. Did you know that you can become a trainer and deliver Team Teach training to staff within your own organisation? Have the flexibility to choose when, where and who you deliver your training to throughout the year. Find out more about this cost-effective option on the Team Teach website. One thing I'm wondering, and one thing we often ask on the podcast, is what you wish you knew then that you kind of know now about all of this. Yeah.
So for the majority of my life, I lived with Noonan syndrome, knowing at 16 that I had Noonan syndrome, but without a support network or a community that really understood it other than my mum and dad. But that again, we were alone, if you like. My brothers, we were alone. So when I was in my mid-30s, I found the Noonan Syndrome Association, which had been in existence for a few years. But up until that point, it was kind of like searching in the dark. So what I wish I'd have known at the time, for as long as I could have accessed it, is that support group, the Noonan Syndrome Association UK. And I would say that if anybody's listening to this podcast that thinks about Noonan syndrome for a reason, because it's in their life for whatever reason, I would say please do consider getting in touch with your local support group, whether it's the UK, that would be Noonan Syndrome Association UK, or the international groups. There's France, Belgium, Denmark, there's Australia, there's so many other European groups, international groups that are supportive. I wish I'd done that. I wish I'd known about that earlier on.
Yeah, and we were talking a little bit off air that, you know, with my experience and kind of working across different sectors, education, the charity sector, mental health, special schools, mainstream schools, and apart from actually when I spoke to you last time and we sort of talked off air, I hadn't heard of Noonan's at all, and it's really interesting those stats that you bring up, because I have definitely heard of the other rare diseases. So yeah, I think bringing awareness, helping people to find support as well for it is super important. And I know you've given that really excellent definition, but I also was wondering, sort of how that might show up in our services, the kind of, I know you mentioned, some of the neurological kind of impacts and how it might influence behavior. But I know with this question, I'm always conscious that it's very generic, isn't it? And everyone's an individual. So making that clear with the question.
And that is the thing to say is it, just as I've said, you know, like some people, the features are so mild that they wouldn't get a clinical diagnosis. I got a clinical diagnosis because of various physical features that they were able to say, yes, this is Noonan syndrome. But some people, it's just not that obvious. That's the same with all the neurodiversities that are involved, any kind of physical health condition. It's so variable from one person to another. And what the difficulties that I might have, the differences in my functioning or my health needs might be very different from me to someone else that has Noonan syndrome. Does that make sense?
Yeah,
so it is very variable. But overall, Noonan syndrome, as far as we know now, because more and more things are being found out about it, it affects our appearance. It can affect our physical health and various aspects of that. It affects our social and emotional functioning and our social and emotional health. And it can affect our neurodevelopmental, our neurodevelopment. So if I'm talking about appearance, like even my face looks like somebody who's got Noonan syndrome. So my eyes are slightly downturned, my ears are in the wrong place on my head. And whenever I say that, people go, what? But they are. So that affects my hearing because my ears are in the wrong place. The eustachian tubes sit differently within my head, so they don't drain as effectively. I get glue ear. I also have all sorts of things around that, like small lower jaw. There's all sorts of things. I have webbing on my neck, which is difficult to really describe, but basically the ligaments on my neck join further along my shoulder than most people's do. That's normal for somebody with Noonan syndrome. I have very short stature, so I'm 4'9", and if you're under 4'11" for a medical reason, then that's classed as dwarfism. Okay, that's the medical term for it. So I have proportionate dwarfism because all my limbs are in proportion to the rest of my body. That's proportionate dwarfism. And that has affected me through school because I was upset about it when I was young. Like, why is everybody else growing? Why am I not? I still look like I'm 10 and everybody else looks like they're 18. That kind of has an emotional impact. And depending on your attitude towards that, as you grow and older, that can impact you for the rest of your life. And it depends on your positive mental attitude towards anything, really, doesn't it? So your social and emotional well-being around anything to do with Noonan syndrome depends on how positively you view it. So growth is affected in terms of physical health and appearance. It's not affected for everybody, in an obvious way. What we're actually saying for Noonan syndrome now is that generally we're shorter than average for our family. But for some people, you're much, much shorter than average for your family. Okay, but we have friends, our Dutch friends who are 6 foot, but then the rest of their family is 6'6", 6'7". So they're short for their family. With all sorts of health issues, heart issues, heart conditions, various heart conditions, skeletal problems, scoliosis sometimes, feeding and eating difficulties. Very often children with Noonan syndrome slow to wean, have projectile vomit, failure to thrive, very fussy eaters, all that sort of things. It can be really difficult, and that can go on into adulthood. But most people grow out of their feeding issues, but for some of us it doesn't. Visual and hearing difficulties, bleeding difficulties, lymphatic difficulties. There are so many issues in terms of our health. And in fact, at the moment, the lymphatic issues are kind of new on the horizon in terms of
Ah.
our awareness. And there's research going on. Professor Sahar Mansour at St George's has done quite a bit of research on that. And we have a webinar on the Noonan Syndrome Association around that. But if we've got lymphatic issues, we might get swelling in our feet and hands. That can, in school, obviously impact our ability to write, our comfort levels, whether we should, our access to exercise can be affected by our ligament and muscle tone, so lots of impacts because of the physical needs. And also hospital appointments and stays.
Yeah, of course.
Lots of those, some of us. So,
yeah. And I can see actually hearing that of actually, when you said in the introduction, like it affects every cell in the body, actually just kind of hearing, and of course it's a variance for people, depending, but just hearing, just so many different parts of someone's life with the disease being impacted, and even relating that back to being in the school environment, imagining myself having like really sore ligaments, swollen hands, and like I don't want to pick up a pen. Like I don't want to sit in my seat all day being uncomfortable,
And when you think about that in terms of, like, you might have lymphedema, lymphatic issues going on, you might have that, but combine that with potentially you've got poor muscle tone and lax ligaments. So even if all you've got is poor muscle tone and lax ligaments, writing is hard because it's difficult for you to sit in your seat. Even now, when I sit in a seat, I'm always slouching on things and resting my head, because actually it takes a lot of physical effort to sit upright. When all through school writing, I would get really bad hand pain. I was always told that I held my pen funny, but that's because when I put pressure, my ligaments bend. I mean, you can see that on the camera, but you can't see that
for the listener. I got a really good visual of the ligament bending.
My fingers are all bending all over the place, and it's painful. Doing my exams was painful. I would just be constantly shaking my hands out. So yes, things like that. If we're thinking about access arrangements for exams, for writing, if you've got a child that's really struggling to write, we've got to look at, why is that? Do we need occupational therapy? Do we need physiotherapy? Do we need to make reasonable adjustments in terms of writing, depending on how significant those needs are?
Yeah, there's so many things to consider with it. And one thing that was coming to mind when we were sort of listening to that last segment about, identifying if someone's like struggling with writing and kind of supporting someone with the disease, but more so I'm thinking about how in school, how would we kind of go about sort of flagging that we think that someone might have the disease? Does that make sense? Because it feels like it'd be like, well, I think they've got Noonan. I don't know.
And it's not our job to diagnose.
No,
that's the medical professional's job to diagnose, isn't it? But like there's actually a group called Medics for Rare Diseases, which is a charity that raises awareness amongst medical students about rare diseases, because this is crazy, even amongst medics, the rare diseases are little known and very little covered on their initial medical training. And that's insane, because although rare diseases, so many of our rare conditions are incredibly rare, ultra rare conditions where it's affecting just 1 or 2 people within the country, right? But even though that's the case, if you batched all the rare diseases together, Medics for Rare Disease really flag this up all the time. That affects 1 in 17 people. 1 in 17 people have a rare disease. And one of the things that they say about it is, to medics, is if you have somebody with different systems being affected, bodily systems and functions being affected, then you should be thinking, we need to investigate for rare diseases. Okay, so if you have someone within your classroom or your setting that has a kind of different kind of appearance, maybe they're not growing like their peers, maybe they have delayed puberty, maybe they have a heart condition or skeletal issues, you're noticing motor coordination difficulties, Neurodiversities are really common with
Mm,
with Noonan syndrome because of all the neurodevelopmental issues. Because if you imagine, our brain cells are affected.
mm,
So the things that we know are highly associated are dyslexia, attention deficit, dyspraxia, dyscalculia, autism. Dr. Shriti Garg at Manchester University was the first person to be able to clearly say there's a high association of autism and Noonan syndrome. And
mm.
I think that's only about maybe 10, 20 years ago that
Okay,
was
okay, yeah,
noted.
yeah.
Um, anyway, so those things are associated. If there's a potential of those things, then we know with those conditions there are executive functioning difficulties associated,
Yeah.
right? So if we're noticing that we've got muscle tone and ligament issues, maybe they're complaining of headaches, potentially rarer, but also epilepsy, potentially.
Mm,
Then we need to be thinking there's lots and lots of systems affected. The social emotional difficulties.
mm,
So many of us have problems with emotional regulation. On the one
mm.
hand, some of us have alexithymia. I can't even pronounce it. That's like not really being aware of emotional other people's emotions and our own emotions,
Mhm.
right? But some of us are hyper tuned to it. Like I would say I'm hyper tuned to it, hyper
Uh-huh.
emotional. Um, everybody in my family would say the same, right?
That's a good review, yeah.
Yeah, it's a very good review. But I feel like I'm very I'm very tuned into other people's
Mm,
emotions, very
mhm,
responsive to that. Um, some of us have low self-esteem and mood disorders.
mhm,
Okay, those are highly associated. It's very reflected in the Living with Noonan Syndrome research by Dr. Catherine Caveni at Loughborough University. She
mhm,
did a social sciences research
mhm.
Browning syndrome community and found so many social difficulties and social differences reported. So if you're seeing these things and you're seeing things across so many different systems, we need to be thinking like medics for rare diseases in education. If
Mhm.
it's affecting multiple systems, might not be Noonan syndrome. We're not saying it is, but we can be flagging this with parents, asking whether there's been paediatric investigation. Where are we with that? Have pediatricians, has the pediatrics department referred to genetics? Have there been genetic testing?
Mhm.
Okay. Has there been a clinical review? All these things can be raised all together. But in education, we can be documenting need
Yeah,
in these
yeah.
areas and providing that documentation. So it really isn't up to us to diagnose,
No.
but it is up to us to think, there's this, and this going on. Here's the package. Here you go, mum. Here you go, dad. Here you go, carer. Let's work together. Then parents might already be on the case with this. Medics might already be on the case with this, but your information is so incredibly valuable in that diagnosis process. Yeah.
Yeah, and that awareness, and I think this episode is really gonna yeah, help staff to just to have that awareness and kind of draw, I'm thinking with some of the individuals that I work with that actually we probably do have loads of things that
Yeah.
really point towards Noonan syndrome. And then I'm wondering, yeah, like actually, if we drew all the evidence together and help to present that to families, that could be
Yeah.
really helpful. So I think that's such a great point to raise about we're not diagnosing, like that isn't the thing, but actually if lots of things are pointing to something else, and actually it's in everyone's best interest to just give the
Yeah.
facts, like this is what
Invest.
we see.
Yeah.
Yeah.
It's fact collecting, much like if you were thinking, if you were in a mainstream school and you're collecting evidence for your graduated response, okay, and
Mm,
you're supporting pupils to mitigate any particular need, you're collecting that evidence anyway.
mm.
It's no additional work, but it is about keeping your eyes open. And so if a pupil has a diagnosis of autism, not putting everything down to autism necessarily. It's
Mm,
like when I worked in special school, my brother has Down syndrome. Okay, it's adopted fostered brother. Like I always kind of thought, oh, this is what Down syndrome looks like because this is what Scott looks like, you know.
mm,
And then it's only when I was teaching a child that had Down syndrome that also got a diagnosis of autism that my eyes were open to, actually, I've been blind to so much because I've seen just this condition.
Yeah.
Does that make sense?
It does.
So
Yeah.
there might be a diagnosis already, and that diagnosis is really useful. And I really believe in diagnoses as not labels, but signposts, right?
Yeah.
Signposts to the right support and to their
Mm,
own understanding of how they function. But a diagnosis can also shut down doors to other things that are just as
mm,
important. And so we need to keep our eyes open to what is actually going on. And we're not the people to decide that. Other
mm.
people are.
Yeah. It's absolutely fascinating, this, and it's definitely opened my eyes to, yeah, thinking and holding in mind some of the individuals that I work with, and kind of, yeah, how I can support them even more. But
Yeah.
I wondered if you could just wrap up the episode
Yeah.
with 3 top tips for the listener.
Yeah. Yeah. So I want to start with, if you notice a pupil that hasn't got a diagnosis of a rare condition, but you're noticing there are multi-systemic issues going on, okay, then obviously it's not our job to diagnose, like we've just said, but what we want to do is be collecting evidence and then having conversation with parents or carers to say, is this being investigated further from a pediatric point of view or a genetics point of view? And if it hasn't, okay, I would recommend that you do that, if that's what we would like to be
Mm-hmm.
saying, okay? And that might be then you can support in terms of evidence collecting, okay,
Mm-hmm.
and helping the parent be able to go with armed with all the evidence that you've got, okay.
Mm-hmm.
So that's the first thing. But then if you have a pupil that's diagnosed with Noonan syndrome, to have a low threshold for investigating things like autism, attention deficit, dyslexia, dyspraxia, dyscalculia,
Mm-hmm.
to get people in and do those assessments. So don't be waiting, because it's very, very likely that those issues are there.
Yeah.
Alongside that, I would say with that number 2 is that if a child's got very, very mild issues with dyslexic type behaviors or attention deficit behaviors, mild issues with a lot of things culminate to quite a big thing.
Mm-hmm.
Right. So we might dismiss because, oh, it's not that big a problem. They only have mild issues with reading or spelling. But also there's issues with number, and there's, number disability or dyscalculia issues
Mm-hmm.
going on, and attention. That adds up to such a big package that we need to not be thinking, oh, well, it's very mild. We need to be thinking, okay, this pupil needs a raft of support. Low
Mm-hmm.
threshold, raft of support might be necessary.
Mm-hmm.
Okay. So the third thing is help people connect to community that understands Noonan syndrome. So in the UK, that would be the Noonan Syndrome Association UK, but obviously other associations worldwide. With the Noonan Syndrome Association, it's really important for me to mention that we have different types of membership. Okay.
Mm-hmm.
Our prime membership is for individuals and families that are directly affected with Noonan syndrome.
Mm-hmm.
But we also have an associate membership for people who are working professionally and have an interest.
Okay.
So
Yeah.
if you're a teacher, a teaching assistant, working in education in any way, social worker, speech and language therapist, anything, occupational therapist,
Mm-hmm.
you can join membership. And also we have an international membership, right? So they're different tiers. They're all free.
Mm-hmm.
Get access to different things. Okay. All of them, you would get access to our webinars. And we have an education webinar. We have lymphatic webinars. They're
Yeah.
available online. Okay. So I would say connect with your membership, with your community, get information, come to us at the NSA, find us online and join us if you want.
Perfect, Andrea. And as I say, thank you so much for sharing some of your lived experience with Noonan's syndrome. And I really appreciate you kind of opening up about that and sharing that with me and also with the listener. And I'm 100% sure that lots of people are going to be looking up the syndrome. That'll be me. And looking at the website. All the links will be at the bottom for people to
Yeah,
access.
fabulous.
And once again, thanks again for coming on to the podcast, and catch up with you soon.
You're welcome, Claire. Thank you so much for having me.
You've been listening to the Team Teach podcast. It's been great to have you here with us as we discuss behaviour, communication, and the ways we can best support those in our care. Thanks again, and I'll see you next time.